time to officially open the resource centre here in Talbot this afternoon. Some of you will know me, others may not. I'm the Vice Chairman of Abertawe Morgannwg University Local Health Board, and I have a long connection with this town. It goes back to 1972 when I first started, and I've seen the progression of medical facilities in the town. It started as a house in Cwmavan Road, and then in 1973 moved to the health centre where some of you still practice from until recently, and then the practice that I was in moved out to a purpose-built building in Fairfield, the Fairfield part of Talbot. And now, of course, the 4 surgeries have moved into this particular building here. The delivery of this resource centre, Minister, has been a hard road. At times it has felt like 1 step forward and 2 steps backward. And I'd like to commend to you, Minister, the hard work, the enthusiasm, the grit and the bravery of everyone associated with this project. There is now a wealth of expertise, of know-how on how to achieve an outcome that both the structure and the opportunities of this building can offer. And I know that you had in your brief the cost of this, which is quite enormous in terms of what we've done in surgeries in the past. And you provide us with 62,000 square feet of floor space. Not a small project.
My name's Steve Roman, and I'm one of the GPs who feels privileged to work from this magnificent building. Having been involved in the planning and development from the very beginning, attending meetings I do not care to count, with many highs and lows during this process, I can now look back, as many will, and say it was all worth it. The ethos of this resource centre has always been to integrate services, with a patient-focused perspective, delivering services within the Neath and Talbot locality, and looking at the most appropriate patient pathways. We now have a state-of-the-art 21st century building to do this from.
This is a fine example, I think, for the future of joint working with health, social services and local government, which is very important. I'm sure my predecessor's Health Minister Brian Gibbons is here today will be very pleased to see the progress of work we made on joint working since he was in that portfolio, and how I think we're going from strength to strength, not only with that involved in the statutory sector, but also the voluntary sector as well. This is really the future for me, because I think our NHS reforms, if they're about anything, are about getting down the barriers between primary and secondary care, and also for us to think more laterally about where care should be taking place. I'm a firm believer in preventative medicine, and I have to say, what a beautiful building. When we came round the corner, I thought it can't be that, it's huge. And then when you come round, the design is so beautiful. The practices were brave enough to make a decision to all come together here as well, and I think that's quite important, because I think it shows the future in terms of how we can innovate across the piece. There's about 150 staff working here already from various disciplines, and I'm sure it will be an enormous success.
Hence the hoist you can see in the ceiling.
That's great. Not sure what the green, right? You never have problems with your feet. You can't. You take them for granted, I think. Yeah, you do take them. Don't pamper them now.